All right, time now for our Monday panel of Press Gallery journalists. Joining me this week, Tonda MacCharles from the Toronto Star, Joël-Denis Bellavance, the Parliamentary Bureau Chief for Presse, and John Ivison, a columnist with the National Post and Parliamentary Bureau Chief for Post Media. Good to see you all. Tonda, I think a lot of us and our political leaders were hoping the corner might have been turned on the pandemic, and I guess now everybody's wondering how the arrival of the Omicron variant changes things, and in particular for governments, federally and provincially, in terms of how they could be forced to respond. What are you watching for?
Well, look, already there are many questions today. For one, are we going to extend the list of country bans? For two, does this mean a change in terms of how we roll out booster doses in Canada if this variant is still responsive to the vaccinations? They tell us, as of last week, they were saying, wait, we need more answers. But there are cases now found in Canada, in Ontario and Quebec, as we've heard. And so it begs the question, where is the health minister? Where are the officials? They gave a briefing on Friday, but 3 days later, there are many more questions. Even the U.S. president came out today to address some of them. So this department, has not learned a lesson through the last 4 waves of COVID. They need to be responsive and on the ball and dealing with people's questions right away.
Yeah, Joël-Denis, what are your thoughts on that, especially as, I guess anxieties are on the rise in the country because nobody knows quite what to expect from this new variant. The health minister, Jean-Yves Duclos, not much to say today, expecting, I think, that we'll have some more news from the federal government tomorrow. Not sure what to expect, but what do you think we could hear from the minister and public health officials?
Well, more robust measures. Some of them were announced last Friday, as we know, and I was told that the health department is working on some new measures that will be announced either tonight or tomorrow, most likely tomorrow on Tuesday. And those measures will probably include measures that touch the border. So can we expect maybe people coming from all the continent of South Africa, of Africa, having to observe a longer quarantine, or even that same policy applies to all foreign travelers or Canadian travelers coming back to Canada. So there is a possibility of that. And in fact, the health minister from Quebec said, Christian Dubé, said today that he had some discussions with his federal counterpart and said, you can expect maybe new measures that may affect you if you go and travel this Christmas holiday season. So what you see today may not be the case when you come back in Canada if you leave now. So so that means that we should expect new measures at the border.
It's starting to feel a bit like, John, perhaps early days of the pandemic and some of the travel restrictions that might be back on the table. What are your thoughts on the challenges that this new variant could present on the issues we've discussed, but what's been a slow and sometimes fragile recovery, may hang in the balance again now, perhaps.
Yeah, news hates a vacuum, and people are reading stories. For example, the chief scientist of Moderna saying he suspects that this variant will not respond to vaccines because there are 30-odd mutations with it. Now, he does say that Moderna could quickly produce a vaccine and could be available as early as 2022. But you would hope our leaders would come out and try and reassure us to the best of their abilities that, we're not heading back into the early days of the pandemic, that it doesn't necessarily mean a lockdown, that there is no evidence that this variant is more severe or that it's killing more people, because I think what we've seen so far suggests it probably isn't. But if it's not responding to a vaccine, then that's obviously very concerning. And I think that, as Tonda pointed out, we should have had somebody out today talking about this. Every other country in the Western world seems to have had a briefing from senior officials. And, again, like Britain, they're making booster shots available to people over 18. So there are things that governments could be saying right now.
Tonda, there's also, you touched on it, I think, the debate over the sharing of vaccines, and that's now back in the spotlight. The argument that we'll keep seeing the emergence of variants from countries where the vaccination rate is low, and that countries such as Canada have not been fast enough to deliver vaccines to developing countries instead of hanging on to offer booster shots. Is this going to be a moment where, and the NDP was talking about it today, saying this is why Canada needs to go to bat at the WTO and say that, we need to relax patent rules so that some of these developing countries have the ability to make these vaccines. Is there going to be a certain amount of reckoning for Canada here on how it's handled the vaccine issue?
Look, I think that question will have new life now because obviously variants are proliferating in parts of the world where there's very low vaccination rate to date. And, through no fault of the country's own, they have no supply. So that's going to be a live question. And remember last spring, this was a really, I think, touchy challenge for the Liberal government when even as they were taking in vaccines for our population from our contracts, we were also dipping into the pot that we'd allotted for the developing world. So but I did notice today that the U.S. president promised that, no vaccines that they plan to send abroad would be taken from the pot that would go to U.S. citizens, or basically assuring U.S. citizens that they would be covered. That's the kind of assurance that the ministers could have come out today and given Canadians. We'll ensure there's coverage here. But meanwhile, this is why we have to tackle the international issue and the absence of vaccines in so many countries. But look, just to Joël's point about other measures, I noticed that both the Ontario and Quebec health ministers today, or actually it wasn't the health minister in Ontario, it was the chief medical officer of health. They're urging everybody to take more precautions, but they're also calling on Ottawa to do more. So I think there are issues that politically the government has to address and fast. Else they'll be charged with neglecting their duties as they were last year through the second and third waves.
Yeah, Joël-Denis, talk to me about that and the challenges facing the government here in terms of the ability. In the past, the government was accused of trying to do too much in some cases and restrictions that were tamping down the economy. But they're going to face these same questions again and the need to keep Canadians safe.
Well, before this variant came on the scene, remember the federal government was being accused of going too slow at removing some of the restrictions for travelers. And when they announced it was not enough. Now, so it's the other side of the fence now. And I think they will say that we were prudent and cautious. So I guess we'll see how this variant is transmissible and if it causes as much damage as the Delta variant, for example. But I'd like to come back to the sharing of vaccines with other countries. Currently, Canada is so far walking on some eggs. Remember, Mr. Trudeau was not, the one leading the charge to make sure that some pharmaceutical would share their formula with other countries, so that they could have their own industry and their own company to make it in South Africa, for example. Canada is trying to rebuild its biofabrication industry, so they will be walking on eggs for the foreseeable future, not wanting to scare off some potential industry like Moderna who wants to come to Canada. And because we will be favoring, sharing their formula to build a vaccine. So that's Canada is a very difficult situation right now, sitting on the fence as a result of it.
John, just in the minute or so we have left, I want to get your thoughts on it. Last week, when the federal government rolled out its latest measures for COVID support, the finance minister said this would she hoped, be the last COVID-19 support package the government would have to do. Talk to me a little bit about what the government could be facing here if they've got to do this again against a tough fiscal line.
Well, I think we shouldn't get ahead of ourselves. I mean, I do think that, the chief scientist from Moderna, for example, I was referring to, he said, we know an awful lot about this disease now. We're not going into it cold like we did in 2020. So I don't think that any government around the world suspects that it's going to have to ramp up and spend the hundreds of billions of dollars that it did in the last 18 months. Having said that, I do think that most folks thought that we were out of the woods. The government had set aside another $7 billion for sensitive industries and for workers who were in those industries. Maybe we do have to go back to the well again. It may not be quite as plain sailing as we had hoped it was going to be. But I think people should be relatively optimistic that we've got this far, that it's not March 2020 all over again, and that at some point vaccines that do work against this variant will be available. And it sounds like they might be available pretty quickly. All
right, lots to watch for. We'll leave it at that. Thank you all for your time today. Do appreciate it, and we'll talk again soon. Take care, everyone.
Thanks.
Thank you, Peter.
Thank you.